we hear the term heart failure, many people assume it means the heart is beyond help. But that's not the case. Joining us today is Dr. Michael Bradner, a cardiothoracic surgeon and director for Mechanical Circulatory Support with BayCare, to talk about the innovative ways that failing hearts are being treated today. Thank you so much for joining us today, Doctor. How you doing?
Great. Thank you for having us.
So it sounds like, we're going to be jumping into a misconception here. So what does heart failure actually mean?
Yeah, and heart failure is a wide term that obviously means that our heart is unable to pump enough blood to the rest of our body. And certainly that can be bring some trepidation to anybody who maybe carries that diagnosis or hears it. And certainly there are multiple types of heart failure and things, and they can be acute, that can happen with a heart attack, versus sometimes chronic things. But it is certainly a large portion of the population that has heart failure. Be about 6.8 million people carry the diagnosis of heart failure in the United States.
Okay, that is eye-opening. I had no idea it was that many. Okay, so I want to dive in and talk a little bit about technology, though. You oversee the Mechanical Circulatory Support at BayCare.
Yes.
Explain how these modern technologies are helping people, maybe even stabilize or potentially even recover.
Correct, and this burrows down into what I do and love doing every day, is we have patients who, let's say, have a heart attack tonight, and their heart has an inability to pump all the blood that they need. We have special devices that we can surgically implant that help these patients recover from their heart attack and recover their heart function. Then there are some patients who have chronic heart failure, and that we are able to place surgically implanted devices that stay with them for the rest of their lives. Technology that didn't exist a decade ago. Technology that these people would unfortunately pass away because of the advances that we did not have a decade ago to allow us to take care of really sick individuals that can recover and get better and live an active, healthy life.
I was just going to ask, 10 years ago, we didn't have these things. It's just so exciting. And I can tell the passion you have just in talking with you right here to help. I'm curious, so when you take the next step, are there symptoms, are there things that people can look out for or pay attention to maybe see that their heart isn't functioning well before you get to that point? For
sure. And everybody is on the lookout for these things nowadays. Our primary care physicians, our cardiologists, we have to be on the lookout for things that we don't attribute to just aging. People get short of breath and they say, oh, I'm getting older, or they get fatigued and they can't go as far as they used to. Or, hey, I used to be able to work out and now I can't. That's not right. We should be able to continue to do the things. Yeah, we may have to slow down, but that doesn't mean we shouldn't not be looking for things that could be fixable. And whether that goes from medicines from our cardiology colleagues to surgeries that I do, to the things like this, where we take people and put surgically implanted devices and all of these things to get people better, to get a better active life for them. That's what we're looking for, and that's what we want to do.
I got to tell you, Doctor, I have learned so much from you today. I really appreciate you coming in and talking about this and addressing how technology has helped. And I know this is some of the things that all the BayCare doctors are happy to help, happy to inform. And in fact, if you want to learn more of the things we just talked about, BayCareHeart.org.